Hi, I just wanted to reach out and I have Dr. Cristi Moore here, and we wanted to reach out and just talk about what the difference is and have an audiologist talk about what the difference is between Costco hearing aids and what it's like, kind of a versus and what it's like to have professionally fitted hearing aids from an audiologist. So, Dr. Cristi Moore, thank you very much for joining.
Thanks for having me today. Looking
Awesome.
forward to it.
Cool. So I guess let's just jump right into it, right? It's
Yep.
going, somebody needs to make this decision. I need hearing aids. It's so convenient for me to walk into Costco, right? And go like, oh,
Yep.
I'm here to pick up my groceries and they have hearing aids. So what's the difference and how can we dive into this?
Absolutely. So Costco has sold hearing aids for a long time, several decades. So this is nothing new. And they are always going to be about having, good quality products at a really low price. That's what you know for Costco when you go in anytime. And their hearing aids are no different. So the thing with hearing aids is that they are a device and they are something that is fitted to your ear. Prescription hearing aids are programmed to your hearing loss, and that's exactly what Costco does as well. The difference is the follow-up care, and that's what a lot of people don't understand is that there's a lot that goes into being successful with hearing aids. It's not just getting the device, putting it on your ear, turning it on, and magically now you can hear everything you did when you were in your 20s. It requires a lot of follow-up care. And that's something that Costco isn't always able to provide, at least not to the same level. The pricing that you have at Costco really is considered to be for the devices. They don't charge for the ongoing follow-up care, but they also don't necessarily require the types of follow-up care that you might receive from going to an audiologist or hearing aid dispenser that is not part of a big box store.
So
And
can you
yeah,
follow up
go
on
ahead.
that? So what is the difference then? Like, so if I get one from them and then I walk in the next Saturday because I run out of coffee creamer,
Yep.
um, what is what is that difference in follow up? Is if you could please just kind of
Yes. So
get
I'll
a
kind
little
of
deeper.
explain. Yeah. So let me explain kind of what we do, and that might make things a little bit easier to understand. So when you get hearing aids from our practice, we are going to order top brand hearing aids. We're going to check them in. We're going to run an analysis on them, which is making sure that they actually meet the specs. So kind of like doing a diagnostic on them. Then we're going to bring the patient in, we're going to program them, we're going to adjust the volume based on your hearing loss. That's what we call a prescription fitting. And then we're going to verify them using what's called a real ear verification system. That's to make sure you're getting the proper amount of sound that's amplified for your prescription, your hearing loss. Also, making sure it's verified for your ear canal shape and size, and then making sure you don't have too much or too little in the wrong places. So you're getting that the sounds that you want to hear appropriately. And then we're going to show you how to use them. We're going to show you the basic care and maintenance. We're going to possibly hook it up to your cell phone if that's something that you want to do. And then we go over a lot of techniques about adjusting to sound because it's like going through physical therapy for your ears. There's going to be exercises and things that we recommend for you to recognize those sounds auditorily. And we're going to have you come back in, usually for 1 to 2 weeks afterwards, and we're going to check the fit. We're going to check the sound levels. We'll make adjustments if we need to. We'll talk more about assistive devices, ways that can help you hear better in more challenging environments. We'll talk about more techniques about how to hear, how to involve your family. We do some testing in the booth with the hearing aids on after a certain amount of time of wearing them. We do maintenance checks. So we have you come in 2 or 3 times a year. We clean and check those hearing aids thoroughly. We may retest your hearing annually. So there's a lot that goes into that to make sure that you're getting the best experience and not just fitting you with a device, sending you out the door and saying, okay, see us when you have a problem.
So really it's more about that relationship and the training and the growing with your device versus here's your hearing aid, thank you very much, and continue with your shopping.
Exactly. That's exactly right. And the model that Costco has doesn't always allow for that same level of consistent follow-up care. Part of the lower cost is that they kind of bet on the fact that most people that they see are just going to need the minimum amount of care and maintenance so they can fit them, they can show them how to use it. Maybe they'll see them once or twice a year to do like a clean and check or something like that. And the rest of the time, they're not necessarily going to see them for that ongoing care. But we find is that, especially in the first year, most people need the most care, especially if they're brand new to wearing hearing aids. They need that follow up because they've been without sound and they don't realize how much their hearing has changed over the last several years or decades. And we're suddenly giving them back sound that they haven't been used to hearing. It's a retraining process. Yeah.
Interesting. So and so my mother-in-law has hearing aids and
Mhm.
so and her mom did before. And I remember like hearing high-pitched sounds, right? And so a lot of it was taking care. Is that, I mean, I'm assuming that's part of that routine, right? Of learning how to adjust them and having that personal care come through.
Absolutely. So, there can be things that, we check. We want to make sure that there's not excessive earwax buildup in the ear canals because that can affect the performance of hearing aids. And if it gets to be too much, it can not only affect how you hear, but it can create things like acoustic feedback. So that's that whistling that you sometimes hear that people might have when they wear hearing aids. That can do to the fit of the device, that can do to having something blocking the ear canal, such as earwax. So it's very important. That's why it's really important to come in and have those devices maintained or have your ears checked to see if that's something we need to maintain for you as well.
That is amazing. Well, and thank you for clarifying that, right? Because it is that personal relationship. It is that, and
Yeah.
especially the education part of it. I liken it more to getting the newest operating system and where did things change and where did they move,
Yes.
right? And if we look at a device that you go in on the street and let's say you're buying a Samsung or something and you're getting their phone, but they don't have the people there to train you versus buying that Apple device and while you have the Genius Bar and you can walk in or make an
Yeah.
appointment, walk in, but they can teach you how to use it step by
Exactly.
step.
That's exactly right. And that's kind of what we maintain ourselves as being, kind of what you said. Yeah, the convenience of going into Costco, you're getting your groceries, and oh, by the way, I'm going to stop at the hearing aid center. But that still means that you have to make a trip to Costco. You have to find a parking spot. You have to go in to the big, open doors, just like you do if you're going in for shopping, show your ID and go through, and then walk all the way, usually to the back of the store to go to the hearing aid center. And so there's always that's going on too. And some people don't want to have to go to Costco every single time they have an issue with their hearing aid.
Yeah. Well, and again, that catering, right, where the distance is shorter, they see a friendly face as soon as they open the door when they come into
That's
your facility.
that's exactly right. And sometimes there's waits too at certain Costco's. Sometimes Costco's that are really busy might have, a 3 week to a couple of month wait for certain things as
Wow.
well. So
Wow.
yeah.
So what else can somebody expect like with this the professionalism but seeing
Mhm.
a friendly face getting to be able to sit down in a nice quiet professional environment what else can somebody expect that they get from Sonora Hearing Care versus Costco?
So we're going to work with top name manufacturers. And what that means is that we're going to work with all of the name brand hearing aid manufacturers. There's about six of them. And so if you decide, or let's say you decide that you don't want to work with us anymore, let's say you move away. Let's say that you're no longer in a place where it's convenient for you to come to us and you need to go somewhere else. You can do that. And those hearing aids can be programmed and worked on by any audiologist or hearing care professional that works with that brand. What happens with Costco too is that Costco, because they get special pricing on a lot of their hearing aids, they also work with brands that are now specifically for Costco.
Mm.
So you may have a brand that is recognized and used throughout the hearing industry, but it's going to have a different name and be an exclusive model specifically for Costco. Because again, that's part of their contract with having that pricing, right? It doesn't mean that they're bad instruments by any means. It's not what I'm saying, but they may have some features that are not available on some of the more recognized name brands. That also means that anyone outside of Costco, most likely is not going to have software for that particular brand. Like we don't have the software for some of those brands now that they've gone to more of that model. So that means we're going to be limited on what we can do. We're not going to be able to take over care and help with the programming and the verification of those hearing aids. So we're going to be limited to just kind of giving you education or just cleaning them for you, but you're going to have to go back to Costco to have them worked on or repaired because most independents are not going to have access to that software.
That's interesting. So their software is proprietary, and it almost sounds
There's
like their hearing aids are also proprietary as well.
in a way, you can get the software as independents, we can, but it's a little bit tricky. And it's going to be up to whether the reps may give it to you or not. Some do, some don't. Again, it's not that they're locked. It's not that they come to us and we can't program them at all, which is how it used to be. It used to be that they would have the same brands or similar brands that we did, but they would have a code that would keep them locked, meaning that anybody outside of Costco couldn't program them or read them out. They had to go back to Costco. So they aren't that way. But again, it's a decision that you make. Do I want to have one more manufacturer that I have to learn software for? Not necessarily. And that's where you might find limitations when you get your hearing aids from Costco or Sam's Club or a big box store.
Interesting. So and so as we live life, right? And let's say we're traveling for the holidays, and holidays just passed, or we're, summer's going to be here in 6 months, and so we're going to be traveling. So that actually brought up I just thought of a question of going, okay, so I'm out of state. I don't have
Yep.
access to my audiologist, and I don't have access. So if I purchase from Costco, I don't have access to Costco because there's only a Sam's Club or a BJ's around.
Right.
How do they get theirs fixed versus, so what I'm hearing though is with an audiologist, because these are specific brands, is that if something were to happen, right, I break my hearing aid or something goes severely wrong, I'm able to walk into another audiologist, not necessarily walk in, but schedule an
Right.
appointment
Contact another audiologist,
and
right,
get it
that
fixed.
works with that brand of hearing aids and potentially get help. You may have to pay like a transfer of care fee or some sort of service fee, but yes, you should be able to walk into an independent practice, whether it's an audiologist, ear, nose, and throat office that works with that brand of hearing aids and be able to hopefully get it serviced. Yeah.
How interesting. How interesting. So the convenience in the long run seems to be more of a hindrance.
Right. Right. It can be. Yeah, absolutely.
Awesome. Let's talk about the follow-up. Like,
Yeah.
we as you get a client, they are now, they're your client. You fitted them with the hearing aid. You chose, the right one that's the right fit. What's the process after that?
So after that, then again, we're going to make sure that they understand how to use and care for those hearing aids before they leave our office that day, because we want to make sure that they, are able to put them in, they're able to take them out. If they're rechargeable, they're able to put them into the charger. And they understand what the lights mean on that type of thing. So a lot of those basics, we go through basic cleaning, like brushing off your microphones with a soft toothbrush, making sure that wax is not building up in the little components that where the sound comes out. So those are going to be the main things we're going to teach you kind of the day that you're fit. And then typically we'll schedule like a 2-week follow-up, and that's just for us to check in to see how you're doing with the fit, what's going good, what's not going so good, what can we change? Do we need to make some adjustments? If we haven't put them to their most appropriate target, like we're starting them off with at a lower volume, maybe we start raising up to that more appropriate algorithm for them. So we're doing those things like that. And then after that, we may have them come in like in another month. We may have them come in 3 months, schedule their maintenance appointments, do some aided testing. So we will put them back in the sound booths, run some sentences and speech in quiet and noise, make sure they're hearing what they need to, and kind of just going through that assessment with them.
What is I guess the follow-up look like from an audiologist versus a Costco?
And not knowing, all the details, not seeing personally what it's done at a fitting at a Costco. But what I can say from my experience from others who have either worked there or patients that have come from there, A lot of times they get the fitting, they do the verification, they show them how to use them. They may assist them with phone pairing if they have time to do that. And then a lot of times they may not schedule a follow-up, but they'll just kind of say, okay, if you're having any trouble, come back and see us. It depends on the Costco center. Some will schedule a follow-up as part of their protocol, some will not. But usually if everything's going okay after the first or second, appointment after the fitting, they pretty much aren't going to be proactively scheduling those follow-ups or maintenance. It's going to be more like, if you need us, we're here.
Gotcha, gotcha. So, anything else that you would like, somebody to know? And again, the differences between the professional audiologist
And the
and
Costco.
Costco hearing aids. Yeah.
Yeah. So the one thing I will say is that, the price is always going to be the best at Costco. And no audiologist or hearing aid dispenser or independent practice is probably ever going to be able to beat or meet the pricing for the same level of technology that Costco is offering. And that's because our overhead, a lot of the cost of the treatment plan for hearing aids is one part of the hearing aids, but a lot of that is that follow-up care. So, we don't have the luxury of having other goods and services help pay or offset the cost for what we do. Everything that we do, from our service fees, from the purchase of hearing aids and treatment plans, pays our overhead, our revenue. And so it's important to understand that when you're supporting a practice like ours, you're supporting usually an independent, maybe a small business, family owned, maybe a small chain as well. But that's what you're paying for, is not just the hearing aids themselves, but you're paying for all the services, all that follow-up care, for us to be here when you call and say, my hearing aid broke, and we're there and we say, sure, we'll get you in today, tomorrow. So that's kind of what I want people to understand, that the cost is involved. There's a reason for that. It's not just the hearing aids, but it's all the follow-up care that goes with it.
Okay. Well, and a lot of times I find, people are willing to pay more for that relationship, right?
Yes.
The peace of mind that my audiologist is there, they're taking care
Yep.
of me, they are taking care of my hearing. They could possibly be taking care of my husband's hearing, or my wife's
Yep.
hearing, my husband's hearing, just the entire family at some point. But
Yeah.
that reassurance that you're there versus that individual that fitted you with your hearing aid at Costco may not be there next year, right?
That's
That
exactly
turnaround
right.
is
Yeah,
going to
that's
be very
exactly
high.
right. There is some turnover that can occur with that. Absolutely. And we have lots of patients that we have started off with fitting, a spouse, and then they bring in their spouse or their partner, or a family member. And so then we end up having that relationship with them, which is great. And that's how we get a lot of our business, is word of mouth as well.
What would you say to somebody who goes into Costco, they bought a hearing aid and they hated the experience? It was horrible. And they're just like, you know what? I'm done. Because
Yeah,
they look at the one experience from somebody that is not a trained professional, right? Somebody that has studied hearing and eardrums, right? They're not doctors. And so, what would you tell that individual who has just said, I had a bad experience, I'm done?
right. Well, some of the professionals at Costco are audiologists.
Okay.
Most are hearing instrument specialists, and so there is some differences with training in some of those two professions. But basically, regardless of whether they had an audiologist, whether they had a dispenser, if the experience is not what they had hoped for, then I would say, okay, let's start over. Especially if the hearing aids are a few years old or out of warranty, we can start over with that process, and we'll go through the whole thing and kind of say, okay, this is what you're getting from us, and this is what we can promise you with hearing aids. Here's what we expect. Here's what we can provide you with, that treatment cost.
That is fantastic. And this just reminded me of your conversation where you have usually what, 5 to 6 different hearing aids, right? So that's really a match. You're able to offer more opportunities to match that hearing aid that fits you and your lifestyle. So I think
That's
that's amazing
exactly
to have
right.
options.
Yeah, exactly. There's a lot of brands out there, and they all think they're the best, of course. And so a lot of the brands have some very specific features that are very unique to what they do. And so there may be some reasons that we may select a certain brand for someone that has certain symptoms over another brand. But for the most part, we can pretty much do most what we need with most of the manufacturers out there. Most audiologists or dispensers that are in private clinics are going to maybe have two or three that they work with the most, but are comfortable working with the 4 to 5 to 6 that are available out there.
Cristi, this was amazing. It was educational, and audience, I hope you find the viewer. I hope you find this information helpful. And if you have any questions, Cristi, where can they get a hold of you?
We are on the web at sonorahearingcaretucson.com. You can follow us on Facebook, LinkedIn, Instagram, and our clinic address is in Tucson, Arizona. We're at 520-881-8740.